Across the U.S., the coronavirus is hitting African communities hard. In many cities, the majority of those dying from COVID-19 are African, even when we are not the majority of the population. Right now is the critical moment in this pandemic, predicted as the peak infection time when hospitals will be overwhelmed and run out of beds, equipment, and supplies. Be informed. Protect yourself, your family, and our community. Stay close to home for the next few weeks. Don't go anywhere, including the grocery store and pharmacy, unless it is absolutely necessary. The coronavirus spreads through the air and lives on surfaces. People can be carriers of the virus and don't know it and can still spread it. Try to maintain at least 10 feet distance from other people when out in public. If you have to go to work or to go out for any reason, wear a mask or a bandana and glasses to cover your eyes. Wash your hands often with soap for at least 20 seconds, especially before you touch your eyes, nose, or mouth. If you're out somewhere and can't wash hands, carry and use a hand sanitizer with at least 60% alcohol. Frequently disinfect surfaces at your job, in your car, or on your bicycle. Stay healthy. Eat healthy foods, drink plenty of water, get exercise in non-contact sports like walking, biking, or calisthenics. Spread the word to others and protect our community. For updates on the coronavirus, tips on building your immune system, and a video on how to make your own mask, visit developmentforafrica.org. That's developmentforafrica.org.
The views and opinions expressed on the KETO FM radio network are those of the hosts, guests, and callers, and are not necessarily those of the station, its management, or other hosts, sponsors, and or underwriters. The shows found on the KETO FM radio network can promote any lifestyle, belief, religion, political affiliation, or other personal practice. These shows are for entertainment and educational purposes only. Statements or show topics are not necessarily the beliefs of this KETO FM radio station. KETO. This is KETO 93.9 FM. 93.9 FM.
Tell me what's the word now? Oh, sister woman, have you heard from Johannesburg? You tell me that our brothers are over there hard to find a man. And we don't know for sure because the news we get is undeniable, man.
Uhuru, welcome to the first episode of the People's War Radio Show. I am Atobe Nyunyu.
And I'm Titaro Masimba.
And you just heard some classic Gil Scott-Heron from 1975, a song called Johannesburg. He said, and I quote, "We tell that our brothers over there are defying the man. We don't know for sure because the news we get is unreliable, man." End quote. Well, that's why we are here, to bring you the reality and the outlook of the African working class from St. Louis to Johannesburg on the worldwide coronavirus pandemic and how the African community can organize to defeat it and get free.
As of April 1st, there are nearly 1 million people infected worldwide with the coronavirus, and almost 50,000 have died. It is projected by July, over 100,000 people in the U.S. will die from COVID-19. More than 85% of people in the U.S. live in cities or states under stay-at-home orders. Workers are being laid off in droves, and unemployment is predicted soon to reach 32%. Many small businesses will never reopen.
And we know that the Black community will be hit the hardest by this crisis. We're already facing high unemployment and a lack of health care. The government is giving trillions to bail out the big businesses. But what about us? We need to get organized to take care of our community. Like Marcus Garvey said, and I quote, "Action, self-reliance, the vision of self and the future have been the only means by which the oppressed have seen and realized the light of our own freedom."
On March 12th, Omali Yeshitela, chairman of the African People's Socialist Party, called for a people's war in response to the effects of the coronavirus pandemic on African people all around the world. He said, "This is not a medical problem, this is a political problem. The people's war is mobilizing African working class political power over our own conditions. Each week on the radio show, we will talk with organizers, doctors, workers, small business owners, and others, keeping you, our community, informed and empowered to survive and thrive in these critical times.
For our first episode, we are super excited to welcome a very special guest. She is the International Director of the All African Peoples Development and Empowerment Project and a physicist who has dedicated her skills for the development and empowerment of African people. Please join us in welcoming Dr. Aisha Fields.
Uhuru, Dr. Fields.
Uhuru, thank you so much for the invitation.
Absolutely. Can you begin by telling us about ABDEP and what are some of the things ABDEP has done since its inception?
Sure. ABDEP stands for the All African Peoples Development and Empowerment Project, and it is an organization that was established by the African People's Socialist Party in 2007 with the goal of organizing the skills that African people have anywhere around the world in the areas of agriculture, education, healthcare, clean water, and in other development-related areas. And the goal was to organize the ability to have people with these kind of skills, African people with these kind of skills, contribute to a process where we could build concrete community-based programs, not only on the continent of Africa, but in African communities in the U.S., in the Caribbean, in Europe, in South America, everywhere African people find ourselves. And to be able to not only just build concrete community programs, but to participate in the overall African liberation struggle, to have a space where, certain kind of skilled African people can, have a way that we can contribute to the ability for African people to be self-governing, to be a self-determining people. And since 2007, ABDEP has been building a variety of programs on the continent of Africa and in the U.S. in particular. We've built community farms, community gardens. We've built maternity centers on the continent in Sierra Leone, where we've organized networks of African midwives, nurses, and traditional birth attendants to help to deliver something like 3,000 babies without death of one mother or child. We've organized vocational schools on the continent, nursery schools, a variety of youth and adult education programs, like our Marcus Garvey Youth Program that offers African children access to African history and politics, also offers them access to hard skills that they typically wouldn't have access to in the colonial education system, things that will help our children and our people be more self-reliant, teaching African children how to grow our own food, how to prepare plant-based, meals, how to create their own business, skills that we know our children need to have access to, but that the colonial education system doesn't offer them. We've built a variety of healthcare programs, not only, like I said, around maternal health, but building programs that address many of the chronic or colonial illnesses that African people have, like diabetes, high blood pressure, and other kind of diseases that African people are disproportionately, getting. And so ABDEP has really been doing a lot of work to make sure that that African people take up our responsibility to the African nation, that we recognize that the skills we have don't belong to us as individuals, and that we're a part of an organized process to contribute those skills towards the liberation of Africa and African people worldwide.
All right, very good. So I appreciate that in terms of, contributing the skills to the liberation of Africa and African people. Can you tell us about the People's War Strategy, what it is and why it is an important campaign?
So on March the 12th of 2020, Chairman Omali Yeshitela, who is the chairman of the African People's Socialist Party that leads the Uhuru movement, of which ABDEP is an organization, called for the establishment of a COVID-19 commission that would be comprised of various leaders in our party and movement, and which would have the responsibility of mobilizing not only the members of the African People's Socialist Party and the Uhuru movement, but mobilizing the entire African nation to respond to the needs of African people in this period of COVID-19 pandemic, recognizing that African people are going to be, just like we've always been, disproportionately affected by this virus. African people find ourselves extremely vulnerable, not only now, but prior to this virus, very vulnerable to not only the disease itself, where we can see even just on social media and news reports how many African people are being killed, by this virus. But we can see that that there are a lot of things that our people are impacted by economically and otherwise because of the various levels of quarantine that exists not only here in the United States, where I'm talking from and where you all are, but in Africa and other parts of the world where our people are experiencing this crisis. And we recognized, and the chairman recognized, that we needed to be able to mobilize our people, our movement and our people to meet the needs that we have during this time. And so this COVID-19 commission was established. I have the responsibility and the honor of chairing that. And we calling all of the efforts that we're involved in the People's War. This is the People's War that we are involved in. So all of the various fronts of the Uhuru movement, all the various organizations and institutions that make up the Uhuru movement are actively working to meet the needs of our people during this time, to provide information about how to minimize your risk of getting COVID-19, how to identify symptoms, how to boost your immune system, what to do, if you have to care for a loved one that has COVID-19, how to prepare yourself for the quarantine, what, efforts we can do collectively to ensure that nobody in our community goes hungry, or that nobody in our community doesn't have, access to medicines or other kind of essentials that we're going to need at this time. And so the People's War is just that. It is a process of involving the people, the whole of the African nation, in a process where we don't have to sit home and wonder and hope, that the mayor or the governor or the president of the United States or the president of South Africa is going to do something that's going to secure secure our families, or do something that's going to solve the problem, but recognizes that we have a responsibility. And if we want to see a solution, it's not going to come from those places. It's going to come from the people, and mobilizing the people in our own interest to be able to do everything we possibly can collectively to not only survive this thing, but to get on the other side stronger than we came into it.
All right. And we've heard the People's War Commission advance this slogan, colonial virus. And to say that before there was the coronavirus, there was the colonial virus, which presupposes that there were conditions before the coronavirus that we needed to deal with. Can you talk a little bit about those conditions faced by Africans here in the U.S. prior to the coronavirus?
Well, one of the things that I think is very clarifying that our chairman and movement have been saying for a long time now is that there are two Americas. There are two Americas. There's the America that white people experience and enjoy, and there's the America that the masses of African and other colonized people experience and don't enjoy. We have a situation where African people experience much higher levels of homelessness, of joblessness, of less of a life expectancy. I think there's something like 7 to 10 years difference in the life expectancy of an African person in the United States versus a white person. But we're living in the same, in the same geographical location with theoretically access to the same resources. But that's why we say theoretically, because we don't. There are two Americas. There's the grocery store that you go to in the white community that has fresh produce and nothing outdated and, reasonable prices. And then you go to, if there is a grocery store in the African community, you get in outdated foods, you get in vegetables that, that probably were shuffled from the grocery store in the white neighborhood that are no longer going to be sold and brought into the Black neighborhood. If you've got a grocery store, more than likely you've got a corner store that's selling junk food that's, that's contributing to the high rates of diabetes and high blood pressure that African people are faced with here in this country. We've got extreme levels of violence that are perpetrated against our people by the colonial state and by everyday members of white society who function as the white people state. We have all kind of conditions that exist in this America that would allow us to see that what white people experience is not the same thing that African people experience. And that the only way that this can be understood is if we understand the fact that we are a colonized people, we're a dominated people who, while we might share the same geographical space as other people, do not have the same experience. And that can be said of African people anywhere.
All right. Thank you. What a great response. And, we also understand you are doing work with the African People's Socialist Party, has forces on the ground on the continent of Africa. Can you say anything about how the virus is affecting Africans on the continent?
Well, for some time, I think, and hopefully we're breaking out of this understanding, because we have to break out of this understanding. But there is a certain kind of line that's been put out there that African people cannot be affected by the COVID-19 illness. Mm-hmm. That African people, either because of the amount of melanin we have, or because the virus supposedly doesn't like warmer temperatures or whatever, and many of us, on the continent or in other parts of the world may live in warmer climates, that somehow that we were not susceptible to getting, this virus. And I think there were a lot of questions that even scientists and politicians were raising about, why isn't Africa being impacted by this virus like other places have been impacted, because the world is so used to Africa being the place where all the world's diseases and epidemics are played out for the world to see. That's supposed to be the disease place, not Italy, not Spain, not the United States of America, not the Great Britain, but what we understand, of course, is that this is not a virus that does or doesn't attach itself to someone's melanin, but that this is something that can and has impacted African people and has killed African people all over. And right now, Africa is beginning to see more and more cases of, COVID-19. And many places in Africa, many of the states in Africa are under extreme lockdown right now, which our people on the continent are very, very vulnerable. Not only in terms of their health, but in terms of the political situation on the ground as it relates to this virus, and as it relates to the economic implications that quarantine, will have on our people. And what we can see in places like occupied Azania, South Africa, where the African People's Socialist Party has an organization, and where other organizations in our movement are being built and grown under the leadership of our party there. What we're seeing is, repression. We're seeing the neo-colonial state of South Africa, shutting down all of the many of the local working class vendors who, would sell their vegetables and goods on the street, and making it only possible for people to get foods and the things that they need from the major white corporations, where people are having to stand in long lines close to each other, potentially spreading the virus in order to be able to get the basic things that they would need, and feeding the ability of these major white or neo-colonial corporations to have access to people's resources, while the everyday person who, makes a living from selling their vegetables is being harassed and shut down. We're seeing our people not having access, as usual, really, to basic kind of things that they would need to protect themselves or to minimize their risk, like soap, like masks, gloves, and other kind of disinfectant and other kind of, materials that would be important right now. And so we're having, really to sum up, the best way for us to be able to intervene. And right now our organizers on the ground are organizing various communities in South Africa to be connected, to understand where the needs are in the community, who are the people that may be sick, who are the vulnerable in the community, to be able to meet the needs, be able to share resources, to be able to put out information about, best practices, to be able to sound the alarm, when things are happening that the people need to know about. So the situation on the ground throughout Africa is becoming much more critical. And one more thing I would say to that, just about Africa in general, is that prior to the coronavirus pandemic, Africa's healthcare infrastructure was non-existent. Absolutely non-existent. Most of the times, the neo-colonial presidents and parliamentarians or those who have resources don't even go to hospitals on the continent. They fly to the United States or they fly to Europe, because there is no, there may be one or two doctors that service, a whole, 5 or 6 hospitals. I know I personally had experiences in Africa where, comrades had to be flown to England after coming down with certain kind of illnesses, because there was no medicine, there was no running water in hospitals, there was no electricity in the hospitals, there were no doctors in the hospitals. But what were in the hospitals? People ready to take your money, So that was the condition already on the ground in the continent. So if you can imagine where people are scrambling here, concerned about the number of hospital beds in New York, one of the major cities in the world, not having enough hospital beds, not having enough ICU beds, not having enough ventilators. Imagine the condition in Africa where there may not be a ventilator in the whole of the hospital system where you are. So our people are incredibly vulnerable right now, and we have to be prepared to do what we can to address that.
Wow, thank you. You are listening to the People's War Radio Show. I'm Chichara Masimba, here with my co-host, Matot Unyu, and we're talking with Dr. Aisha Fields of the All African People's Development and Empowerment Project.
Thank you, Dr. Aisha. Can you tell us about Black Ankh, its history, and the work that you're doing now through Black Ankh, and why it's needed?
So thank you for that question. So Black Ankh is a program of the All African People's Development and Empowerment Project. It was initiated in 2014 as a response to the Ebola epidemic that really hit West Africa very hard. And at the time, in 2014, we had a fairly strong APDEP and presence, and also presence, generally speaking, of the African People's Socialist Party in Sierra Leone, where we had, like I said, built many programs around health, around agriculture, education. And when Ebola it hit Sierra Leone extremely hard. And while we didn't have the ability to offer direct care to people who had Ebola, we did have, based on the skills of our forces on the ground in Sierra Leone and based on the resources that were available generally throughout APDEP, we did have the ability to initiate some really important programs that we launched under the program of Black Ankh, the African Nations Response to the Red Cross, the African Nations Emergency Preparedness Program established by APDEP. And so what we were able to do in 2014 in Sierra Leone was we trained more than 40 community health workers, on regular people, everyday community people, on the prevention and identification of Ebola virus disease. We connected with more than 40 Ebola survivors and their families, providing them with food, medicines, hygiene supplies, medicines. And we also organized a campaign that where we work with community entertainers to be able to develop jingles, develop skits where they could go out into the community and hold up Ebola survivors who were having a hard time. There was a lot of stigma associated with Ebola, and people were having a hard time coming back into their communities because people were very frightened. understandably frightened, but we wanted to be able to break up that stigma and have the community really embrace our brothers and sisters who were coming back home after being treated, or the family members of people who had died or who had, even survived Ebola. And so, taking those skits out into the community, raising up Ebola survivors, calling on people to embrace them, to come back home. These are our heroes. Now's the time to, to welcome them back home. And so that initial program of Project Black Ankh, since that time, we had been involved in other kinds of initiatives under the banner of Black Ankh, notably in Houston, Texas, in response to the 2017 hurricanes that hit there pretty hard. But we have always seen the need to be able to build Project Black Ankh as a permanent program of under the leadership of APDEP, a permanent program that could win African people, healthcare workers, other kind of skilled Africans, and everyday people who just want to contribute to the ability for our communities to be prepared for natural disasters, to be able to respond to natural and imperialist imposed emergencies, and to provide humanitarian aid that our people would need in such times. And so so Project Black Ankh really in this period has been reignited, and we intend to not only have it reignited, but to, from this point forward, really allow this to be a permanent program where Africans are constantly being trained, brought into this process. Donations are being brought in so that as things happen, as we know they will, that we'll be prepared to intervene on behalf of the African nation.
Wow, very good work, and a whole host of very practical programs to really address the most critical on the ground conditions. So, I hold that up. And then also the Black Ankh project, of course, as you said, it's a response to the Red Cross, but it also, harkens to Garvey's Black Cross nurses. So that's a critical thing. Is there more that you can say about, the kind of outreach activity that may be happening on the ground in response to coronavirus? And, not just the virus itself, but the whole political context that you bring to this discussion.
Uhuru. So right now, under the COVID-19 Commission, the People Commission, that, we are building on many different fronts, as a part of this people's war. And so Project Black Ankh again is being reignited to win African and other people who can work under the leadership of APDEP and Project Black Ankh, building the capacity to provide telehealth services, so that if you're at home taking care of someone who has COVID-19, or if you have it, and we know that the healthcare system, well, then there is no healthcare system, so to speak, even in the United States, but so that the hospitals, are not able to, take care of the numbers of people who will be impacted by this. Already we're seeing people being turned away from hospitals, and some of whom have died shortly thereafter. So we know that there's a critical need for people to have medical questions answered, to have advice and support when dealing with this. So we have a telehealth program that's going to be rolled out very soon. We're calling on African medical personnel again and others to join our medical team. People are joining. I want to really appreciate the people who've been volunteering up to now, doctors and nurses and nurse practitioners who have made their skills available to this process. We've created a number of different brochures, leaflets, posters that are part of this whole people's war, because it's not just about people who may have specialized skills doing something for the community, but it's about the whole people being involved in one way or another in the process of protecting and defending the African community. So we have, like I said, established, we've developed a number of leaflets that are summing up the coronavirus situation, things that you can do for your health, how to identify, how to, again, take care of people who might be under your care, how to boost your immune system, those kind of informational pieces. And various members of the Uhuru movement around the world are participating in putting those flyers out, doing drops in their communities, going door to door, putting up posters everywhere so that the community can begin to prepare itself for what's to come and to really understand, what is happening. And we've made this process open to anybody, even if you're not currently a member of the WHO movement. Those resources are available on our website, developmentforafrica.org. So you can download the brochures, you can download the posters, you can share them with your neighbors, you can share them with your family. You can connect with our outreach teams who, again, are going out, everywhere if you want help organizing your block, organizing your community. It's a process that we can help you with, or you can just download it and share it if that's what you want to do. We've created now on our online platforms, our website, developmentforafrica.org, and our social media platforms on Facebook and on Instagram, daily updates that people can go to find out not only healthcare information, but resources for homeschooling, resources for growing food, in this time, which we think is critically important. Also, information that's been provided by the Office of the Deputy Chair of our party that leads all of our economic work and economic institutions that give people and small businesses information about how to access some of these economic resources that are supposed to be made available to the general public, particularly here in the United States. We know African people are not being, nobody's calling them up and saying, hey, these resources are available to you during this time. We know things are critical here. This is how you can do it. But the African People's Socialist Party and COVID-19 Commission is making those resources available. Again, you can get access to that information, how to apply for additional food resources, or the money that's supposed to be coming, or, your unemployment, basic kind of information, how your business can have access to certain resources, your small business available as resources on our site as well. So we've really tried to establish the means by which we can distribute and disseminate information, where we can bring people into organization, where we can allow people to be active participants in protecting and defending the African community, and to call on those of us with specialized skills to turn those over so that can be a part of the overall process as well.
You are listening to the People's War Radio Show. I'm Chichara Masimba, here with my co-host, Matot Unyu, and we're talking with Dr. Aisha Fields of the All African People's Development and Empowerment Project. Can you give us some of the protocols that you've established and adhered to in terms of how people should prevent or respond to symptoms of COVID-19?
So I think that's really important. And I want to really underscore African people that there are a lot of bad ideas that are going around right now. Yeah. There's a lot of misinformation that's floating around right now. And it can disarm us. It can not only disarm us, but it can put us in a position where there's no way forward. It can put us in a position where we feel that we can only be a victim, or it can put us in a position where we think that nothing can happen to us, period. Either way, that puts us in a bad spot, as African people. And we have to look at this thing square in the face and deal with the reality of it. And there are things that we can do, and there are things that we should do, and we should, move in that fashion. So first, I want to say that, what everybody has been saying already, we have to be very careful about our hygiene practices right now. Let me back up. Let me say this. If it is possible at all for you to be at home, whether there's a stay-at-home order in your city or not, whether there's the state telling you have to be home or not, if you can be at home, stay at home. Stay at home. And that's very important because it's very easy to transmit COVID-19. It's a very, 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 very easy to transmit it. And the best situation for all of us would be to be at home and to not risk either transmitting it to someone or getting it, and we don't have it right now. So if you can, stay at home. Whether you're able to stay at home or not, we need to be doing certain basic kind of things. Washing our hands very often. Definitely washing our hands before and after we eat. Definitely washing our hands very well after we use the restroom. Basic things that we know, but sometimes we slip, and sometimes we might run the water just for a minute, pat our hands, and be done with it. Now is not time for the pity pat hand washing. We got to wash our hands. We have to sanitize areas that are used commonly, remote controls, telephones, countertops, doorknobs. We have to do that because the virus can live up to many days. I've seen different kind of reports, and I would rather us err on the side of caution and to say that this virus, especially on certain kind of surfaces like metal, can last for many, many days. So we have to be very careful about that, making sure that we're regularly sanitizing areas that are often touched. If we have to go out for work, to run to the grocery store, or some other kind of essential activity that we have to do, then you should cover your eyes, your nose, and your mouth. Now, I would say initially when we began developing protocols and materials that we began to distribute, our initial recommendation was not to worry about masks. And that was because all of the information, even from the CDC, the World Health Organization, all the people who supposedly know so much about coronavirus and what you should do were saying, don't worry about masks. But what became clear, not too much longer after putting out that particular protocol, was that was absolutely wrong information. And that it was, I believe, it was based on the fact that the medical supplies, including basic masks, are because this country doesn't have them. So they didn't want to incite a certain level of panic among the people because you can't get them. So the recommendation was, don't worry about it. They don't work, But what science tells us, and what other countries who have been battling this and have been winning have been saying, that the number one thing that people need to do is put a mask on your face. Then what we need to do is put a mask on our faces. Not only that, and if we don't have a mask, we can make one. We've got a video of how to make a simple mask up on our website and on our social media pages. If you want to check that out, there are many others that you could probably find online. You can make a simple mask, or you can use a scarf or a bandana or something to cover your nose and your mouth. Cover your eyes with your prescription glasses or your sunglasses, or you can get a pair of $1 reading glasses. Cover your eyes. And the reason why it's important to cover your eyes, your nose, and your mouth is because this virus is transmitted. Is transmitted by entering into your eyes, your nose, or your mouth. So, and it is airborne. Okay, it is airborne. And the virus, if someone talks or coughs or sneezes, then the droplets can remain in the air for at least 15 minutes. So you might walk into a room, you didn't know that somebody had coughed or sneezed, and it hadn't been 15 minutes, and you walking straight into the virus. So cover your eyes, cover your nose, cover your mouth. If you do have to go out, again, you're going to have that covered. Keep your distance from people at minimum 6 feet. So if you're going to the grocery store, you're going someplace, keep your distance. Try not to use public transportation. I've seen videos of even people where this epicenter of the virus is in New York, and they've got packed, city trains. What kind of damn leadership is that? What kind of leadership is that to the people? What that's just outrageous. If you can avoid it, avoid it. If you can avoid it, please. We want people to, if you're sick, if you're feeling certain kind of symptoms, immediately self-isolate. Many of the symptoms associated with COVID-19, the basic ones, are cough, persistent cough, fever, sometimes headaches, sore throat. So if you're experiencing those symptoms, then you should be self-isolating. That means if you're in your home and you live with other people, you should be in a space, in a bedroom or some other space by yourself, not interacting with the rest of the family. If you have the ability to use a different bathroom than everyone else, do that. Use different utensils. Try as much as possible to keep yourself separate from others. If you experience emergency symptoms like very severe inability to breathe, or bluish lips or face, or a new kind of sense of confusion, if you experience, or anything else that may seem severe, then you should seek medical attention right away. So there are more. There's more information about this that's available on our website, developmentforafrica.org. But we really want African people to take this seriously, adapt the measures to what your conditions may dictate. Some places may have access to masks. If you do, use the mask. If you don't, like I said, make one. You may or may not have access to liquid soap. Maybe in your area it's powdered soap. Whatever adjustments we need to make them. But the basic thing is we need to be very concerned about our hygiene, about keeping our social distance, about isolating if we feel sick. And just, again, you can get more information from our website, developmentforafrica.org.
That's great stuff, Dr. Fields. So what are some of the natural solutions that we can do to help boost our immunity?
That's a great question. And that's something that our medical advisory team and other members of our team have really been working on quite a bit. In fact, one of our main outreach materials speaks a lot to immune builders, what we can do to build our immune system. Because right now, that's incredibly important because there are no medicines or anything that can cure COVID-19. So essentially, only thing you can really do is manage the symptoms and allow the virus to run its course if you happen to get sick, and deal with the symptoms. So if that's the case, then we need to be looking at what we can do to try to avoid it, and also to give our body the best chance of fighting it off as quickly as possible if we were to get sick. So building our immune system is incredibly important. So there's some things that we can do. First of all, we want to, and I know this is a struggle because there are a lot of things that we've known even before this virus hit we should have been doing in our diets or in our daily lives that we've struggled with. And right now, we have to really make it a priority to try to do our best around, our health. So really eating fresh vegetables as much as possible, fresh fruits and vegetables. Eating things like ginger, garlic, broccoli, watermelon, sweet potatoes, using honey, spinach, turmeric, almonds, mushrooms, papaya, oranges, lemons, limes, grapefruit, miso, green tea, black teas, sunflower seeds, kiwi, red bell peppers, and then other kind of herbs that we could use like elderberry, which is really good for immune building, echinacea. Of course, vitamin C. If you can find vitamin C somewhere, you should grab it. Everywhere I went, it was, the last time I was out, there wasn't any, but you can eat it through your vitamin C rich foods, like your green leafy vegetables and oranges and lemons and limes, zinc. And there are other things that we can do that are not food related, like getting proper rest. That's very important for building your immune system. Exercising, and also being hydrated, making sure that you're drinking enough water throughout the day. And that's something that I'm trying to make sure that I do and my family does. So you want to, as a rule of thumb, at least try to drink half your weight in ounces of water. So if you weigh 200 pounds, you want to drink at least 100 ounces of water a day. That should be your goal. So half your weight in ounces per day. It should be your goal. So those are some of the things that we really want to suggest to people. There are probably other really great things that people could do naturally to boost their immune systems, but those are some of the things I think are most accessible to the average person.
All right, thank you. And we are coming to the end of this week's People's War Show with our special guest, Dr. Aisha Fields, Director of the All African People's Development and Empowerment Project on the People's War Commission, and who leads the Black Aunt Project. So just briefly, what are some things that you have upcoming? You may have mentioned, but just to leave people with some things that you have coming up.
So I'm really excited that we've been participating in a number of different events that have been organized by different members, different organizations in the Uhuru movement. And we've got some exciting programs coming up with the African National Women's Organization, where we're going to be participating in a discussion around how COVID-19 is impacting African women. And we'll be having discussions with African midwives, doctors, and others who will be, really dealing with the special kind of concerns of African women during. And we're in the process of organizing a conference for African medical workers who will participate in the Project Black Ankh work. And the date for that is tentatively scheduled for April the 25th. So we're going to be calling on Africans from all around the world to plug into Black Ankh and for this conference to be a space where people can join, can get more information, and be mobilized around the programs of Black Ankh. And again, you can stay in connection with all of the work of the People's War Commission and the work to build Project Black Ankh through our website, developmentforafrica.org. You can connect with us on our social media pages on Facebook and Instagram, All African People's Development and Empowerment Project. You can email us at info@developmentforafrica.org. We want to definitely call on people to join ABDEP, volunteer with Project Black Ankh, donate at developmentforafrica.org, and really want to appreciate having the opportunity to participate in this incredible show.
All right. Thank you, our special guest, Dr. Aisha Fields of the All African People's Development and Empowerment Project. That will conclude this week's episode of The People's War. We will be back next week. We want to thank our guests. This has been a great show. We will see you back the same time next week. People's War Radio Show is produced by WBPU, Black Power 96.3 FM in St. Petersburg, Florida. WBPU is a project of the African People's Education and Defense Fund, a nonprofit organization whose mission is to defend the human and civil rights of the African community and address the grave disparities faced by African people in education, healthcare, and economic development. For more information on the African People's Education and Defense Fund, visit apedf.org. For updates and resources to fight the coronavirus or to volunteer with Project Black Ankh, visit developmentforafrica.org. Episodes of the People's War Radio Show are available on the Black Power Talks podcast on podbean.com. Thank you for listening.
This is Dr. Aisha Fields. I'm the director of the All African People's Development and Empowerment Project. Our project, Black Ankh, is working to make sure that our community is doing everything we can to stay safe and healthy during this coronavirus pandemic. Across the U.S., the coronavirus is hitting African communities hard. In many cities, the majority of those dying from COVID-19 are African, even when we are not the majority of the population. Right now is the critical moment in this pandemic, predicted as the peak infection time when hospitals will be overwhelmed and run out of beds, equipment, and supplies. Be informed. Protect yourself, your family, and our community. Stay close to home for the next few weeks. Don't go anywhere, including the grocery store and pharmacy, unless it is absolutely necessary. The coronavirus spreads through the air and lives on surfaces. People can be carriers of the virus and don't know it and can still spread it. Try to maintain at least 10 feet distance from other people when out in public. If you have to go to work or to go out for any reason, wear a mask or a bandana and glasses to cover your eyes. Wash your hands often with soap for at least 20 seconds, especially before you touch your eyes, nose, or mouth. If you're out somewhere and can't wash hands, carry and use a hand sanitizer with at least 60% alcohol. Frequently disinfect surfaces at your job, in your car, or on your bicycle. Stay healthy. Eat healthy foods, drink plenty of water, get exercise in non-contact sports like walking, biking, or calisthenics. Spread the word to others and protect our community. For updates on the coronavirus, tips on building your immune system, and a video on how to make your own mask, visit developmentforafrica.org. That's developmentforafrica.org.
The views and opinions expressed on the KETO FM radio network are those of the hosts, guests, and callers, and are not necessarily those of the station, its management, or other hosts, sponsors, and or underwriters. The shows found on the KETO FM radio network can promote any lifestyle, belief, religion, political affiliation, or other personal practice. These shows are for entertainment and educational purposes only. Statements or show topics are not necessarily the beliefs of this KETO FM radio station. KETO.
There's more anxiety than ever. And
this is KETO 93.9 FM.
At Talkspace.com or download the app. Don't forget to use promo code CV411 for $100 off your first month. This Sunday, April 12th, 2020, Wyoming's disaster declaration has been approved, making this the first time in history that every state and territory in the U.S. is under a disaster declaration. With over 20,000 COVID-19 related fatalities, the U.S. has passed Italy for most deaths. More than 300 inmates and 200 employees at Chicago's Cook County Jail have tested positive for the virus. On the USS Theodore Roosevelt, 550 have tested positive. The Kansas Supreme Court upheld the governor's ban on gatherings of 10 or more people. This will affect religious gatherings in the state. South Korea will test all travelers from the U.S. for coronavirus upon arrival in the country. British Prime Minister Boris Johnson has been released from the hospital. Russia and Japan confirmed their largest number of new daily cases. Venezuela will extend the national state of alarm for 30 days. Saudi Arabia has indefinitely extended the nationwide curfew. Singapore is mandating the use of face masks while in public. Spain will begin to loosen some of the most aggressive restrictions on residents' movements this week. From a nearly empty St. Peter's Basilica, the Pope celebrated Easter Mass, stating, "This is not the time for indifference because the whole world is suffering and needs to be united in facing the pandemic." The locations of hotspots and U.S. and country diagnoses in a moment. Hotspots in the U.S. displaying faster rates of growth as of April 11th, according to the New York Times. Rhode Island, Guam, South Dakota, Randolph County, Georgia, Louisa County, Iowa. Globally, Belarus and Bangladesh have a faster rate of growth. There have been 530,006 confirmed cases of COVID-19 in the United States and 20,608 deaths. Known active locations with 3,500 or more cases. New York, 180,458. New Jersey, 58,151. Michigan, 23,853. Massachusetts, 22,860. California, 22,421. Pennsylvania, 21,774. Louisiana, 20,014. Illinois, 19,180. Florida, 18,978. Texas, 14,827. Georgia, 12,261. Connecticut, 11,510. Washington, 10,224. Maryland, 7694. Indiana, 7435. Colorado, 6893. Ohio, 6250. Virginia, 5077. Tennessee, 4983. North Carolina, 4310. Missouri, 4024. Countries with 4,000 or more cases. Spain, 166,019. Italy, 152,271. France, 130,730. Germany, 125,452. China, 83,134. United Kingdom, 79,885. Iran, 71,686. Turkey, 52,167. Belgium, 29,647. Netherlands, 25,746. Switzerland, 25,300. Canada, 23,316. Brazil, 20,984. Portugal, 16,585. Russia, 15,770. Austria, 13,945. Israel, 10,878. South Korea, 10,512. Sweden, 10,483. Ireland, 8928. India, 8504. Ecuador, 7257. Chile, 6927. Peru, 6848. Japan, 6748. Norway, 6459. Denmark, 6369. Poland, 6356. Australia, 6315. Romania, 6300. Czech Republic, 5905. Pakistan, 5170. Malaysia, 4683. Philippines, 4648. Saudi Arabia, 4462. Indonesia, 4241. Mexico, 4219. No first cases reported in the last 24 hours. For the latest updates, subscribe for free to Coronavirus 411 on your podcast app or ask your smart speaker to play the Coronavirus 411 podcast.
This is ACAST Recommends. Every week we pick one of our favorite shows, and this is one we think you're going to love.
Keep it locked on to KETO 93.9
This is
FM.
Dr. Aisha Fields. I'm the director of the All African Peoples Development and Empowerment Project. Our project, Black Onc, is working to make sure that our community is doing everything we can to stay safe and healthy during this coronavirus pandemic. Across the U.S., the coronavirus is hitting African communities hard. In many cities, the majority of those dying from COVID-19 are African, even when we are not the majority of the population. Right now is the critical moment in this pandemic, predicted as the peak infection time when hospitals will be overwhelmed and run out of beds, equipment, and supplies. Be informed. Protect yourself, your family, and our community. Stay close to home for the next few weeks. Don't go anywhere, including the grocery store and pharmacy, unless it is absolutely necessary. The coronavirus spreads through the air and lives on surfaces. People can be carriers of the virus and don't know it and can still spread it.